Well, as ICU admissions reach new record heights every day, the province is reporting its highest positivity rate since the pandemic began, now up to over 10%. Joining me now to discuss the latest developments is infectious disease expert and member of Ontario's vaccine task force, Dr. Bogoc. Good morning. Great to see you this morning.
Good morning.
So we hear reports of blood clots, or at least one in Canada, in Quebec. How concerned should we be?
We know that this is a very, very rare, but of course not 0% risk of this vaccine. We saw the data from Europe. It's and in the context of administering hundreds and hundreds and hundreds of thousands of this vaccine in the country, sadly, it was going to happen. And sadly, we might see another one as we administer this vaccine in the country. I think it's fair to say that this is a very rare side effect. It's pretty clear that that's the case. And it's also fair to say that, this vaccine is very effective in preventing COVID-19. I think people are aware of what the potential downsides are with this rare side effect, but also the tremendous benefit that this vaccine can afford them in terms of protecting them from COVID-19. And people will make an informed decision. And we're seeing many people still choose to get this vaccine. And quite frankly, I think that's the right choice. We've seen it really save thousands of lives.
Yeah, important to note that hundreds of thousands of people have had this vaccine already. I'd like to talk about the percent positivity at this point. When it reaches 10% and over, it has to be concerning.
Oh, it absolutely is. It absolutely is. I would say that when it's going north of 3 to 4%, it's concerning. And obviously, we want that percent positivity as low as possible. But I think red flags were raised long before we got to this point of a 10% positivity rate. There's a lot of COVID-19 in the community, and of course, your healthcare system is really bearing the brunt of it. It's not that we're about to be stretched beyond capacity. We are stretched beyond capacity. Surgeries are being canceled across the province. It's not every day you hear about adults admitted to pediatric intensive care units. I mean, if that's not a big red flag, I don't know what is. So your health, it truly is an all hands on deck approach. I think April is going to be a very challenging month for your healthcare providers and in the hospital systems. And we really need to do everything we can to get these cases to come down.
We're also hearing this morning of supply issues when it comes to the vaccines, that some of the clinics are now, at least in Toronto, starting to close down. How concerned are you that that race between the vaccines and the variants is starting to be lost again?
It's really disappointing to see that. And, I think it's fair to say that, obviously no one wants to see that happen. Just stating the obvious, there is a delay in a shipment of Moderna, and many of the clinics that are providing Moderna vaccine won't be able to run business as usual. I know it's on its way and it will likely be distributed to those clinics shortly. So hopefully those clinics can get up and running again. Pfizer's coming in like clockwork, which is great. I mean, it's not the only vaccine we have, but it's an important tool in our toolkit. And we're getting in Ontario about 400,000 doses of Pfizer a week. And that's consistent, and that's going out to the clinics consistently. Moderna is every 2 weeks. We get our shipment every 2 weeks, and there have been delays with Moderna, unfortunately. So sadly, that trickles down to clinics that have been providing Moderna. And it's just, you never want to see delays in vaccine in clinics and cancellations, because clearly that's not headed in the right direction. We need to vaccinate much quicker than we are right now.
I'm not going to ask you to wade into the political discussion. However, the communication in and around who's eligible to get vaccines, where and when, has become quite confusing for many people. How do you suggest that people take that information and try and decide where and when they should go at this point?
Yeah, absolutely. I think it's fair to say that we need to significantly improve the communication about eligibility and availability and how to sign up, right? You've got multiple systems to sign up. You've got a provincial website, you've got public health websites, you've got pharmacy websites. It really is unfortunate, because I think that actually ends up being a barrier, sadly, for some people to sign up. I really hope that we see a lot of community level involvement here, and really that people help out their family, help out their friends, help out their neighbors. Some of them might have technology barriers, language barriers, mobility barriers, financial barriers. There's just a lot of barriers to getting these vaccines. And we really need a coordinated community effort to help sign everybody up, who's eligible to get the vaccines. It's not an easy system to navigate, and that's so unfortunate because we really need as many people to be vaccinated as quickly as possible. So this is truly a team effort, and I hope everyone in the country helps out their brothers, sisters, moms and dads, grandparents, neighbors, friends, their community, and just does the right thing and finds out if someone's eligible, signs them up, put on a mask, roll down the windows, bring them into the vaccine clinic, and get them vaccinated.
Well, it certainly takes people like yourself to keep us educated and informed. Dr. Isaac Bogoc, thanks for joining us this morning.
My pleasure.
All right, let's catch up with Stephanie and see how our roads are doing this morning.